Yes, ma'am.
Okay, fine. Wonderful.
Yeah, yes, ma'am. It's working fine.
Okay, fine.
Yeah. So
So
we'll
should
add the
I?
ma'am.
Yeah, okay. Should
Yeah.
I
Okay.
join after?
Ma'am
Your
will join
video
now.
is. Sorry?
Ma'am will be joining now. Parul ma'am will be joining now, ma'am.
Okay. Shall I just stay
Yeah.
online then?
I think we have 3-4 minutes more. We can, ma'am.
Okay, fine.
Yeah.
No, he will take other.
Yes, ma'am. I've added you, ma'am.
Yes, yes.
So ma'am just got disconnected. So you'll be joining, ma'am.
Okay. So
Yeah.
in the live, then we'll be up and down time. That's it.
Yes, ma'am. I'm just adding.
Okay. This, direct.
Hello, ma'am.
Hi, Dr. Parul.
Hello, Dr. Jayashree. How are you?
I'm fine, thank you. How are you?
Thank you. I'm very well. Thank you.
So good evening, ma'am. Good evening, both the doctors. So we'll be waiting for people to join. So we have got a lot of questions, ma'am, after the post in both Instagram and Facebook. So we have a lot of questions. Even there were chats which came on to our Facebook and Instagram pages that yes, I do have this condition. I don't know what to do. So there is a lot of myths which revolve around acanthosis. So the biggest myth is dirt. So today we'll be debunking all the myths, all the we'll reveal all the facts about acanthosis and why it happens and what are the underlying causes. So let us wait for 2 to 3 minutes for all to join.
Yeah, sounds good.
Yes, ma'am. So most of the numbers of views which people have come are from Mumbai, ma'am, and followed to that was from Ahmedabad. And especially the questions which came was revolving around am I a diabetic patient if I have acanthosis? So we have the right person with us today to answer the question. And the second biggest question, I think the repeated question what came is it because of some usage of this chain or I'm using a necklace continuously? Is it because of that? So these are the two questions which were repeated again and again for all the from all the questions, ma'am.
Today in my OPD, Dr. Jayashree, I saw another case of acanthosis. He's a 56-year-old male, not heavy at all, but very stubborn dark pigmentation over here, and of course classically with skin tags and acanthosis on the neck. Now when I probed into the history, actually, except for a very strong stress which he had about 2 years back, and he almost, it was more of work related, and he got into quite a lot of insecurity because it was a big role, and he was sent to a psychiatrist because he was sleepless with thinking about the stress about work, and he was started with Prozac. So Prozac was started 2 years back, and he said very classically, after few months the pigmentation started, and last 8 months it has suddenly bloomed out of. And I've taken pictures, so offline I'll share some pictures with you.
Certainly.
And
Yeah.
yeah, and I've asked him to get sugar and insulin levels and all done so that we can see if there is something else.
Did he gain weight after being put on the Prozac?
No,
He didn't
no,
gain
he
weight.
did
Okay,
not.
so just
No,
insulin,
no.
maybe resistance.
Hmm.
That's interesting. I just gave a talk about 2-3 days ago to a group of psychiatrists actually, and because we were talking about the usage of certain of these medicines which are used for depression and mood disorders and the tendency towards diabetes and weight gain. Very interesting. So I was reading about that. Yeah.
So with Prozac, it is quite common.
Prozac is, yes, but not as severe or as marked. All of them tend to cause it. Some to a lesser degree than others, more the antipsychotics, but definitely the antidepressants also. Some of them are weight neutral. Things like bupropion and all are weight neutral, but some others do definitely cause weight gain. Prozac is known to cause it. That's why I was wondering. But definitely they are all associated with changes, increase in insulin resistance. There's lots of theoretical reasons why they think that may be happening. And one of the things, at least one of the takeaways I got, and interestingly, I had somebody talking to me this morning. She was put on antidepressants and she's gained about, 3-4 kilos, and she thought it was her thyroid. She had a past history of thyroid, but currently thyroid is normal. But one of the most important things with the usage of those medications is prevention. So as soon as people put them on those medicines, we have to counsel them saying, walk every day, remain on a good no sugar, low carb diet, because the prevention is the key. Once it occurs, it's very difficult for them to, of course, we can try, but pharmacological management after the weight gain has occurred is very difficult.
Yeah, very difficult. And mentally, they are, I think, not motivated enough to suddenly
Exactly
go
right.
into a very excelled mobile stage of exercise, and you are asking them to do 30 minutes every single day. And they are professionals or probably students, young students, they don't know how to manage the time for exercise.
Yeah.
So that's a big task, actually.
Yeah.
Ma'am, there is also one question related to exercise and weight loss. So there was a question when it was asked, will weight loss help me to reduce my dark patches? So I think it's good to go, ma'am. People are joining in, so we can start.
Absolutely. Yeah.
Yes, ma'am. All yours, ma'am. Over to both of you, ma'am.
Maybe a brief self-introduction, Dr. Parul.
Yes. I would love to do that. So today evening we have two doctors with us. We have two specialties. We can say the major two specialties or super specialties with us. So we have Dr. Parul Koth. He's a dermatologist from Mumbai, and we have Dr. Jayashree Rajagopal, and she is from Chennai. She's an endocrinologist. So both the doctors have multi-speciality. Why we are having two specialties together for one single condition? So the condition is Acanthosis Nigricans. When we see that there are dark patches on the forehead, there are dark patches on the neck or in the knuckles, or we say in the fingers, in the joint of the fingers, we say this is all dirt. Or somebody in normal language say, you are not taking your shower properly, so you are not cleaning yourself properly. So don't get that confusion with all of that. It is a metabolic disorder, which is Acanthosis Nigricans, which can be serious if not treated in the early times. So we have two eminent doctors with us, Dr. Parul Koth and Dr. Jayashree Gopal. So over to all you, ma'am. So we can start the session. So we'll take the questions which have come from the audience at the last of the session, ma'am.
Suman, do you want to go ahead and just start asking the questions, because it will give us like a little
Sure, sure, sure,
the
sure.
way to start talking about it.
Should I describe the acanthosis to the
Yeah.
people?
Go ahead, Dr. Parul.
Acanthosis nigricans is basically a pigmentation patch, and in fact, it is very classically defined as hyperpigmentation on the neck, behind the neck, side of the neck. Very classically, you will see that the skin is very thickened over there, and it is very velvety and rippled. You'll see those lines over there. And in most of the cases, it starts behind the neck, side of the neck. You can see them under the arms also, in the groin area. Few people do not get too much of thickening, but you can have pigmentation, little grayish brown kind on the face. So it can be seen on the forehead. Many, usually men get that on the side of the temples. And I've seen even on the lower part of the lip, even on the knuckles, you can have them on the elbows, sometimes on the genital as well. So this is quite disfiguring and disturbing for the patient, especially when we see very young children coming brought in by their parents who are almost 10 to 13 years old, and they come in with a history saying that is just about 6 months she was fine, and we don't know what is happening. So this is called as Acanthosis nigricans. Though there are many reasons for pigmentation on the face and the neck, and many external causes, but today Acanthosis nigricans is related, and it is backed up by a metabolic change inside the body, and that is what we are discussing today. So these patches basically are that way benign. They are not going to really give you any itch or anything, but they really look bad. And for these particular cases, we have to identify what is wrong in the body. There are many reasons to Acanthosis nigricans. Like I said, one is the metabolic. So few things like there's a lot of extra insulin in the body, which may be precipitated by overeating, over carbs, having a lot of refined sugars. So in whatever age, obesity, overeating, sedentary lifestyle, and weight gain is a factor which we have seen quite common in people having Acanthosis nigricans. There are many more reasons, like it can be genetic, like somebody in the family having Acanthosis nigricans and you tend to get it. Another main important reasons is co-hormonal abnormality, like cases like PCOD, seen in very young ladies, young women, girls nowadays of 10 to 13, in which they have irregular menses, they have male hormone increase, and with that they have these kind of changes in insulin resistance as well. So when we kind of identify and look into what is happening to them, why PCOD and why they have hair loss, extra hair coming over here, a lot of acne and pigmentation, then we also see other hormones like prolactin. Sometimes the male hormone is also abnormal. And with doing the sonography, we find that the source of the abnormal hormone is ovaries. So a lot of things is going behind the scene as well. And this is the kind of scenario which is quite complex. And that is why we have Dr. Jayashree today explaining to us that where does it begin with, what is insulin, and what is really acanthosis directly related to the insulin resistance or high sugar levels. How would you put it forward?
Yeah, I think that's a wonderful sort of introduction to the acanthosis, Dr. Parul. And I just want to say, for the benefit of some of the people who've been following, I've been doing a series on PCOS, a deep dive into PCOS, which is one of the conditions you mentioned. And because of this, endocrinologists and dermatologists have to work very closely, because the PCOS, the underlying, exactly like you said, the underlying basic pathophysiological mechanism, which is the insulin resistance, affects the skin in many ways. And I'm hoping in the coming weeks, we can also talk about how we manage other aspects of this insulin resistance and PCOS, like acne and hirsutism and skin tags. So, I would love to hear you talk and skin, hair fall and thinning. So thank you very much, because I'm going to have lots of questions also.
Sure.
Coming to your question of, for me, Acanthosis nigricans is basically a biomarker of insulin resistance. I think it's one of the best biomarkers of insulin resistance. We have other ways to diagnose it. If you want to have like a hard number, there is a number we calculate called the HOMA-IR. It's just based on a very, very simple test. We just do fasting blood sugar, fasting insulin, and you put it into a calculator. And if your body's insulin is working very well, that number, that HOMA-IR number is less than 2. You just get a simple number. It's a ratio, no units or anything. If it is more than 2, it means that there is insulin resistance. Now, why is insulin so important, and why does it even have an effect on the skin? Because when I mention, you see these dark patches around the nape of your neck, and this is related to your body's insulin not working properly, people are shocked. Why am I telling them about that? Because it's usually they've come to me for diabetes or irregular periods, like you say. It's because insulin is a central hormone. Thyroid, lung, the intestine, every single cell needs the insulin to function properly. And insulin is something we call an anabolic hormone. So insulin basically makes our body convert all of our energy into fat and store it. It likes to build up things. Anabolic is building up, so it likes to build up things. So it builds up muscle, it builds up energy stores, it builds up fat stores. It prevents fat from breaking down. Now, when we say insulin resistance, what we are referring to is the fact that insulin, multiple actions of insulin. The one that most of us are most familiar with is the ability of insulin to reduce the blood sugar levels. We're always thinking insulin and diabetes and sugar, but insulin is also important for, like I said, it prevents the blood sugar levels from building up, but it also does that by, the main way it does that is it pushes sugar into the muscle, into other cells of the body, so that the blood does not contain glucose and the sugar into the liver, but it also prevents the breakdown of fat. So when the insulin is not working properly, the blood sugar levels tend to build up, but there is also side by side, interestingly, there is also an increased buildup of fat and difficulty losing weight. And this happens, like you said, predominantly because of lack of exercise is what I think, and also a little bit of weight gain around the abdominal area. Even gaining about 3 to 4 kilos around the tummy area is enough to make, particularly Indians, because Indians are extremely insulin, we are prone to insulin resistance. So even if we gain about 3 to 4 kilos, so we may not look very obese or overweight as you put it, but even gaining that extra 3 to 4 kilos around the tummy area, which most of us nowadays think very easily, that increases insulin resistance by a significant amount. And when that insulin doesn't work properly,
ma'am, is there a connectivity issue? I think the voice was breaking. Ma'am, Parul ma'am, I think you also got the voice breaking.
Yeah.
Now it is.
Ma'am, your voice is breaking, so probably.
Oh, is it? Okay.
Now it is fine, ma'am. Now it is fine.
Now it's fine, ma'am.
Okay. I'm just going to change my the place where I'm sitting.
Yeah.
Just give me a minute. I'll try and go closer to the.
So as Dr. Jayashree, you said it is a definite marker of insulin resistance. So every AN case should be, put it that way. So should we be doing serum fasting insulin levels in each and every case of AN?
I like to do the fasting insulin levels only because it is helpful for us to know, like I said, to quantify the degree of insulin resistance. But what is more important is we definitely check their fasting blood sugars,
the
HbA1c and the lipid profile at a very minimum.
And the lipid profile.
Profile.
So these 3 tests, the moment we see, and these will go at each and every age where we see AN?
Yes, every age, including, like we were discussing the other day, I've had children as young as 10 and 11 years being brought in for insulin resistance. For acanthosis, and we've evaluated them and we found significant insulin resistance. So it starts that young. So really, any age, I think it's at a bare minimum, we need to check their sugar and the lipid profile. But all of the other things that go along with it also, we need to keep in mind, particularly if you're going to start other medications. Like, for example, they can have elevated liver function tests. So there's a very common sort of association, fatty liver, buildup of fat in the liver. So sometimes I do also a liver function test, or at least a bare minimum of liver function test. Uric acid. A lot of people, and the reason I'm mentioning all of these concomitant blood tests is because what happens commonly is, instead of addressing the core issue, which is the insulin resistance, and we can talk about how we do that later, people then get put on tablets for cholesterol. People get put on tablets for fatty liver. People get put on tablets for the uric acid. People get put on tablets for the insulin resistance. So you don't need to be on that many tablets if you address the core issue of the insulin resistance, because all of these things, including the acanthosis, will come down.
So at 10 years, what is the predisposing factor you saw? Was it obesity? Was it PCOD?
Yes.
I mean, generally, which one did you see?
PCOS is also due to the insulin resistance, so we cannot differentiate it. But this 10-year-old girl, it was predominantly related to, she was not particularly obese, actually. I would say her BMI was probably just in the slightly overweight category if you sort of looked at her age. But significant family history of diabetes. And typically when you go into a history like that, you'll find that their parents got, the mother had gestational diabetes and then developed diabetes in their 30s or 40s. Grandfather developed diabetes, say, in the 40s or 50s. So a strong genetic or a hereditary component combined with the type of environment we have nowadays, sort of the exposure to excessive junk food, not enough physical activity. She wasn't very overweight, this is just a very unusual case, but it is not at all uncommon. That's what I was trying to say, so often, and I'm sure you're also seeing it, young children being brought in.
Absolutely. I was just about to say, the other day I had a 13-year-old, massive acanthosis, but not really overweight. From a very middle class family, so the junking was not really a part of her routine. Exercise moderate, because while going to school, coming back, they have a decent amount of exercise happening. But massive acanthosis, very mild acne, very mild hair loss. I mean, to see it, it's really sad. And she had huge patches of, there was another condition associated, lichen planus on the sides, and acanthosis almost till, the rippling was till the lower lip, huge patches over here, and just a 13-year-old non-obese. And I mean, it's quite sad to see this all complex combination to such young children nowadays.
The other thing I wanted to mention, Dr. Parul, and I'd like your input, the other place where I've seen significant acanthosis, apart from the overweight, insulin, the overweight category or the obese category, is the other extreme, the lipodystrophy. So people who are very thin, but have this extreme insulin resistance because, again, of a genetic or a hereditary defect. And typically you would know these people because they actually don't have much fat, for example, in their cheeks. So they tend to have a very, and they don't have much fat in this area. So they tend to have a very hollowed out appearance. They look very muscular because they don't have the normal like podginess, which most of us have, like a nice, so they don't have that. So, and that is also associated with significant acanthosis, that's, and it fascinates me that both extremes, too much fat and too little fat, both are associated with insulin resistance and acanthosis.
But biochemically, you would still find positive results in the blood test?
Absolutely, the same reports. In fact, if anything, they're even more insulin resistant. Their sugars will be higher, their fasting insulin will be higher. So fat is, again, everything in our body has to be in balance, including fat. Too little is also not good, and too much. So there's this condition called lipodystrophy where the body does not store fat. Also leads to extreme insulin resistance and diabetes.
And you've always seen skin tags also associated with Acanthosis nigricans, because I've seen them quite a lot. I mean, they're quite big and huge.
And I think particularly more in adults, no? I mean, I'm just thinking maybe in adult women, they seem to have more of the skin tags. And somehow they don't, quite often exactly like what Suman was saying initially, because it happens to fall in the exact place where most of our women wear their thali. They think it's an allergic reaction to this, the chain that they wear or the necklace that they wear. It's
exactly. And could be if at all they're obese and have weight, then the skin folds are kind of friction against the skin folds, that may lead to the skin tags as well. That may also happen.
And they don't realize it. So
Yeah, they don't realize it.
Yes.
I mean, they wait till the skin tags are big and long, and then they approach you.
Yes.
Any other predisposing factors would you like to add, like along with hormonal? We've seen genetic. Now we've seen obesity. Do you feel stress and lack of sleep, or any other medications have you seen? Like we just discussed the antidepressants. Apart
Yes.
from that, any other medications would you
So
point out?
anything that causes that increases weight and increases the resistance of insulin, and all of these things that you mentioned, even lack of sleep for say 3-4 days in a row increases your insulin resistance. That's very clearly seen where even young people, if they don't get adequate sleep for 4 nights in a row, basically their insulin resistance starts going up. So it is not surprising. That's why that we see a lot of children in the 10th and the 12th coming to us with irregular periods, with PCOS, with acanthosis, because that is the time when, they're all studying, not exercising, stressed, exactly right,
Yeah.
stressed,
Yeah.
lack of sleep, exposure to light at night. It's very interesting that usually our pancreatic cells that make the insulin need a break. So if you look at the circuit, they also have a circadian rhythm similar to what we have. So they make a lot of insulin in the daytime when we are eating constantly, and then in the night they actually have to be at rest. And then they start sort of spiking again in the mornings. And if you're exposed to light at night, interestingly, the pancreatic cells keep making insulin all through the night. And it's one of the reasons for hyperinsulinemia and insulin resistance. So again, when I counsel about PCOS and lifestyle changes, that's one of the things I tell them, particularly in that age, the adolescent, the early 20s, go to bed when it's dark outside, wake up when it's light outside is such a simple, advice, what your grandmother used to say, but it actually makes sense, because biologically it has an extreme impact on our body, exposure to light at night. But apart from this, other rare hormone problems like excessive growth hormone. So this hormonal condition called acromegaly, where there is excessive growth hormone production or excessive cortisol production, a condition called Cushing's. But these are all very rare. For most people, it is just the fact that they're not exercising and have gained a little bit of weight, which may aggravate their tendency.
Yeah, many of the dermatological conditions which are autoimmune and they need cortisones for long, like Sjogren syndrome. You have scleroderma, you have pemphigus. These kids and even adults are on high dosage of cortisones and for a long time. So probably they are also at risk of getting this. So probably comorbidity with high insulin levels should be also checked.
Absolutely.
Along with your blood sugar and insulin levels, and probably along with that the medication for insulin levels should be.
Yes.
Ma'am, I had just one question for Jayashree, ma'am. So especially when they are in the college days, like 24, 25 in the exams, they are preparing for the exam, competitive exam. So they stay long night, as you said, ma'am. So is it also related to this artificial light? So now, as you said, then the light will artificial light also will do that, ma'am? The natural light, other than the natural light?
I mean, yes, because artificial light in general means that you're studying in the nights.
Okay.
In daytime, it's unlikely in our country that you're going to be, using artificial light indoors. So I actually, that's a question I have for Dr. Parul, the effect of quite commonly when we talk about pigmentation, pigmentary changes,
True.
The dermatologists say it's because of UV exposure.
Yes.
Can you just tell me about, is it even the regular like tube lights that give it? This sort of
They do. Yes, they do. So there are about 3 components of the UV. When you go out in the sun, definitely the UVB light falls on the skin and causes the pigmentation. But when you are indoors and even closer to your window panes, UVA light can penetrate through and lead to, of course, it's slow progressive, but it has more to do with the the aging of the cells and causing long-term pigmentation. So that is also known. And the third is the blue light, which we now say getting emitted from all these gadgets and devices like laptops.
Blue light,
people who are now, even in COVID times and otherwise, corporate people are on the laptop throughout the 24 hours. So nowadays, in fact, we tune them to use sunscreens which have UVA, UVB, blue light and infrared protection. So these sunscreens also have modified according to the newer times, and people actually look for these properties, and that is important. I mean, we are actually having papers where UVA, the one which passes through your window panes and falls on your skin and causes the pigmentation. It's quite known now.
So, I mean, then that means that even people who are sitting at home in front of the
Yes,
computer
you
for a
have
long
to-
time
you-
also need to use the
Sunscreen.
Yes.
That's interesting. Then I better start using it.
Yes, please do.
Yeah, that's fascinating. But yes, I mean, to answer your question, Suman, definitely the artificial light, like Dr. Parul was saying, it has an adverse effect on the skin. But I was talking more about the circadian rhythm, the change in the
Circadian rhythm, the sleeping
Yeah.
patterns, everything. Okay, got
sleeping
it. ma'am.
pattern, and even the even, for example, we don't take into consideration, when we go to bed at night, the TV light, the little blue light that is
Yes,
on, or the charging lights, or the red
charging
lights.
point.
All these things are picked up by our brain. And
Okay.
it's not just our eyes. Even blind people have these receptors that pick up these, there's changes a bunch of hormones, including things like melatonin and things like that, because of this subconscious pickup of light, which is really not something that our body is used to.
Thank you, ma'am.
So, Dr. Jayashree, as usually when such a case comes, of course, the underlying cause we dig into by doing some basic blood test levels. And when we look at the need of the patient is that please reduce this pigmentation, because this is much seen. Of course, I tell them that it's going to take a lot of time. It's going to be long enough, but you have to accept and take the reality pill that at this 10 or 13 age, you have it. So don't get disheartened. We'll work on it, and that's where we start off. So as you said, about 3 to 4 basic blood tests to be done. And then as a doctor, of course, I start them on with medications for, the relief of the topical, the pigmentation and the thickness. Apart from that, anything else would you want to add upon? Like you said, suppose if we have a obese patient, kind of, so where would you start approaching, and how would you do it?
So one of the most important things is exercise or movement, moving.
Okay. Okay.
Try to move as much as possible. There is no maximum limit. Minimum, I would say. In fact, there was a fascinating, something somebody was presenting the other day saying that particularly for Indians, maybe because we have less muscle mass, we actually have to move more to make our insulin work as effectively as, say, a Caucasian person. We know we are more insulin resistant for the same amount of fat or for lesser fat, but to compensate for that, it also means that we have to walk more. So if you look at all of the Western recommendations, they say, like, for example, for management of diabetes, to reduce the insulin resistance, 150 minutes a week, which is about 30 minutes, 5 days a week. For us, it has been modified 30 minutes a day, 5 days a week. For us, it's been modified to 250 minutes a week, which is roughly about 45 minutes a day. So exercise is key, but exercise for most people will not cause immediate weight loss. Certainly just 45 minute to 1 hour walking is definitely not going to cause weight reduction. And so it's important to set the expectations right. I'm not asking you to walk to get you to lose weight. I'm getting you to walk because I want your body's insulin to work better, so that your periods become regular, or that your sugar comes down, or your cholesterol comes down. So that's the reason why we want you to walk. So first is just get moving. That's the first bit of advice. Take 10,000 steps a day or work out, whatever you choose to do, but 1 hour a day of something at a minimum, and then keep walking the rest of the day. So there's no point in going to the gym for an hour and then coming and sitting down and not moving the rest of the day, which, as doctors, we are terrible. We tend to do that.
Is that doesn't work, is it? I mean, if you finish your 45 minutes of say heavy cardio or run or a jog, and then you have a desk job, then how do you manage
that? Well, I mean, that's why this whole thing came, this tagline that sitting is the new smoking.
New smoking.
So we have
even
to
if
keep
you're indoors, just keep moving as much as possible around the desk, towards the
exactly.
room, wherever you
Exactly,
can.
exactly. Go
Okay.
out, call the
Okay.
patient in, bring them inside, get up, examine
Okay.
them, sit
Okay.
down.
Yeah.
So practically as
Okay.
doctors, we have to do that.
As
So
much as usage of muscle we can
yes,
during the day, we should.
yes,
Okay.
yes.
That's great.
That's number one. Number two is for weight reduction. I firmly believe in a no sugar and a lower carbohydrate diet. So whatever diet you picks your fans, you think works, but whatever it is, even about fighting the fat load in the body. And being aware. So, but I think the basic principles of every healthy diet is no sugar, high fiber, moderate
Yeah.
protein.
Protein.
That's
Yeah.
no junk food. All that I
Yeah.
think all of
Yeah.
us agree
Yeah.
upon. So exercise followed by diet is probably and these other things, which I think we have to actually reiterate. Sleep well, get at least 7 to 8 hours of sleep. Even this morning, I was talking to a young boy, and his mother was saying, oh, he goes to bed at 1:30 in the morning
Yeah.
and he wakes
Exactly.
up at 7. And
7 or maybe at 12 o'clock in the noon also they wake up.
yes, and
So
particularly
any
if you're
particular type of exercise is your favorite? I mean, when you're recommending to insulin resistance patient, is there a particular kind of exercise?
so I
Or
think it's
yeah,
important to do everything in the sense, I
yeah,
think aerobic, yes, walking or treadmill or
okay,
jogging or swimming.
okay,
But
yeah,
also, again, I come back to the fact that as Indians, we have less muscle, particularly women in their 30s and 40s. That may not be the exact demographic we're talking about, but the building up of the muscle mass has to start from a young age. So
okay.
even
And any
simple things like,
sorry,
even when you're, for example, doing yoga, you're doing the Surya Namaskaram, just hold the pose where you're, on your arms for a little bit longer so that you're building up
yeah,
your upper body strength. So
yeah,
I wouldn't call it strength training because then people start thinking, oh, we have to go to the gym to do it, and I can't, the gym is closed, so I can't exercise. You don't need to. But
need to.
basically, toning and building up muscle exercises. I think yoga gives a good mix of both toning and a little bit of muscle strengthening and flexibility.
Yeah, yes,
So a
yeah,
combination of both aerobic and muscle building exercises, because the more muscle you build, insulin has the most effect in your muscle cells. So the more your muscle mass, the more effectively the insulin can work, and you can reduce your insulin resistance significantly. Even for children, when we were growing up, there was this myth that children shouldn't go to the gym, and they
yeah,
shouldn't. There is nothing like that they shouldn't. I mean, obviously, we're not going to get a 11-year-old girl to go and lift heavy weights.
yeah,
That we
yeah,
won't. But
yeah.
uh, for example, they can do yoga. They can do things that put a little bit of help them, build up the muscles and the bones.
Cycling probably, or skipping kind of. Yeah,
Swimming,
yeah.
dancing,
Swimming, dancing.
girls love
Yeah,
to dance. So
yes,
just join an online dance class, anything that gets their
yeah.
heart rate up a little bit, gets them moving. And it's interesting because when we turn to the parents, I'm sure you face this also. And, we tell the mother, you also have to exercise, it's like a,
Yeah.
so, they're like, me?
Entire family has to go. Yeah,
Yes.
yeah, yeah. There's reluctance, and then I tell them, how do you expect the small child to behave when the doctors are telling you have to stop this, and start this? How is the kid going to be motivated to do it?
Exactly. We have to lead by example. We have to lead by
Yeah, we have to
example.
leave. Any particular fancy diet pattern or intermittent fasting which goes good for your insulin resistance patients?
Anything that gets them to lose weight. And like I said, personally, for the last sort of 2-3 years, we've been doing a lot of low carb counseling because
Okay.
I've realized that particularly carbohydrates are a big problem in diets all around the world, and particularly in India. We eat a lot of carbs, and the reason why I'm so
Yes.
fixated on carbohydrate is because of the fact that every time we eat carbs, whether it be simple carbs or complex carbs, that is the one that makes our body make the most insulin.
Okay.
And like I started
Carbs
off
makes
saying,
the maximum insulin.
exactly,
Carbs. Okay.
carbs. So
Yeah.
I made a graph to show that. So simple carbohydrates. So for example, things like sugar, your Coke, or whatever, your cakes and things probably have the highest insulin response. Comparatively complex carbs, and I say complex carbs, people are eating a lot of millets and wheat, and they think that's healthy. That causes the next highest level of insulin response. Vegetable proteins, your dals and your pulses, give the third highest response. It's less than the other two, but still not insignificant. So we cannot go overboard with our pulses and with our dals and sundal, the chana and all that. Number 4, in terms of less insulin response, is animal protein. So egg and fish and chicken is much less. And fat, interestingly, flat insulin response.
Really? And
So you don't need insulin for the immediate metabolism of fat, contrary to what people think. So that is the reason why LCHF diets are so popular. Low carb, high fat diets are so popular. I do not at all endorse it, because I don't think in the long term taking that amount of fat is good. So I always give this disclaimer. But whether you take, say, an Atkins diet or a keto or a paleo or a low carb, high fat, whatever be the type of diet you take, or even say intermittent fasting, whatever be the type of diet you take, when you get down to the core of it, all of them will work on the same principle, that you're reducing the carbohydrate and side by side reducing calories. When you reduce carbs, you need to replace it with relatively more protein, a lot of fiber. So a lot of vegetables. A lot of fiber, a lot of vegetables for the satiety, so that you feel full and that you're not constantly hungry. But for me, it makes perfect sense that the less carbohydrates you eat, the less insulin your body makes. So it's easier to lose weight, not only controlling sugar, but it's easier to lose weight. So I'm a very, very firm proponent of maintaining as low carb as is possible. And even, we've counseled pure vegetarians, even people who don't eat eggs. We can easily, our typical South Indian diet contains about 400 to 500 grams of carbohydrate, a so-called healthy diet. We can easily get it down to around 100 grams a day. And very interestingly, and I was so happy to see this, the ICMR, the Indian Council of Medical Research, this year, in 2020, when they came out with their guidelines, so they come out with their guidelines like once in 20 years or something, they've actually specified saying the carb content in the diet for the first time ever, and they've specified it as, in a non-pregnant person, non-pregnant women, man and woman, 150 grams of carbohydrate per day is what they specify. When we talk about 150 grams of carbohydrate, just to give an idea, 1 small cup of rice, when I say 1 small cup, about 5 to 6 tablespoons of rice is about 50 grams of carbohydrate. And 1 idli is roughly about 15 grams of carbohydrate. 1 roti, 1 chapati is about 20 grams of carbohydrate, even a small thin full cup. So say, for example, 2 idlis, 2 chapatis, and 1 small cup of rice already adds up to about 100 grams of carbs. And then you add your pulses and all that, it adds up. So the bottom line is we have to be eating less carbohydrate.
Yeah, and our even in Indian foods will have chapati, and you don't feel complete till you have rice also. So all of that, I think, adds up to too much of carbs. And
not only eat less, but also eat less frequently. So I have to say this, Dr. Parul, because I get so annoyed when I see this, eat 6 times a day. Because every time you eat, your body is making insulin, right? Whereas
you eat less, and you eat
less frequently.
Absolutely, probably maybe 2 times.
When you're hungry, maybe 2 to 3 times a day. That's how the intermittent fasting works, because you need that gap. And this, I call it, I wouldn't say rubbish advice, but I don't think it's absolutely correct advice to say keep on eating every 2 hours, 2 hours, 2 hours. For some people who are extremely hypermetabolic, it may work because they are hungry. They eat little amounts all through the day. They graze through the day. That's their eating pattern. But for most of us, I think we'll just need to eat twice a day maximum.
And nothing in between.
Nothing
at all. We kind of ideally not.
Ideally not. We are just particularly
making ourselves habituated to okay, it's tea time, let's have chai and biscuit. Oh, it's 7 o'clock snack time, I think I'm hungry. So I think these things can be deleted from the schedule.
So true. So ma'am, like we have been talking and listening from all the doctors, recently doctors have been saying that you have to maintain a proper diet and proper exercise, but after that the patient or the person who is having acanthosis or having insulin resistance is not aware what is the exact diet, what is the exact exercise they should do. I think this will help us to understanding that how we should communicate to the patients and how awareness can be brought in the patients what diet they need to follow and what exercise they should to do and how it is going to help. Because I agree that you'll have a lot of patients then you will not find time exactly to tell the number of time they should do exercise and what are the exercise to be done and what are the diet to be followed. So now it is a tried, we can say that diet, exercise along with the medication, acanthosis or insulin resistance can be managed better.
I had a question for Dr. Parul. I mean, what are all the things that you've seen people do to try and get rid of this because they think it's dirt? I'm sure you would have seen.
Yeah, so first is of course they feel, suddenly their neck is getting darker, so maybe they've not taken a shower properly. And what they do is they keep scrubbing at home with whichever loofah and all the, the scrubbing agents which they have over the kitchen counter, or maybe, anything which they see on the videos on the YouTube and all. And they finally land up with more irritation. And actually we are skin type 4 and 5 Indians, so we will always land up with hyperpigmentation when the skin gets inflamed or injured. So all the more they get into a more darker stage, they come up saying, oh, I use this chemical on the back and I use this thing and I scrubbed it so hard, and then they come back with pigmentation. So that's where I tell them that of course we are looking into what has caused it, but just don't touch. There are very few things which we should be doing, like in the form of cream. So whatever I'm giving, just use it that way. It's not that the more faster you use the faster it will disappear. So have patience. We are looking into the problem of it because it has more of an internal this thing, and you have to live with it for a few months. Don't think that it will just go away. And there's so many YouTube videos which say 3 days mein maine ye lagaya and it has gone. So probably people do get quite fascinated by these kind of videos saying that, okay, it will go away using this acid and that acid and this mixture and that mixture.
I was sharing with Parul ma'am yesterday. There are videos on YouTube with more than 5 million views, ma'am. Jai Shri, will get subscribed. DIY videos for dark neck, underarms. So you will see the video, will laugh, ma'am. Does actually this help? Toothpaste, aloe vera gel, baking powder, besan. So there are a lot of things. So that gives a signal that there are a lot of patients of acanthosis, insulin resistance within us, and they are searching for some solution. So so that tells that the crowd is huge. So we have a lot of patients to treat.
Yeah. Also, what happens, sometimes it may not be acanthosis. Like it may be some kind of an allergy or an irritancy. Then we treat them differently. Sometimes there is sun tanning. People who are on the field job and open neck shirts. Then excess exposure to sun also may lead to a sun tanning. Sometimes it is a kind of reaction to the hair dye. Sometimes we see contact irritancy because of the deodorants and perfume spray. So many reasons are there where probably nothing it fits into. Then these kind of DIYs sometimes have a role. That is why we just don't completely ignore, but we don't promote them also. So right. It works to a certain extent because in acanthosis and other things, the skin gets thickened and darker. And all these, say, baking soda, lemon, honey, a besan, all of them just help to kind of lighten it temporarily. So they feel, yeah, it's working.
It's working.
So, yeah, it's working. And then they keep on using it for a few months maybe, and then they make their own protocol and kind of stuff. So you can't completely ignore it also because it's working a little bit towards the lightening and maybe smoothing the skin or unclogging the pores and maybe softening the skin or maybe brightening it temporarily. So they feel, okay, it's working. But while we talk about acanthosis, definitely nothing of that will work. I mean, home remedies, we just say, no, that's not the right way.
Right, ma'am. Thanks.
So I was just going to also say that, I mean, in my experience, I think when people lose weight and they exercise and we put them on, medications like, say, metformin or alpha lipoic acid, things like that, which help with the skin. I think it takes about 3 to 6 months, but it works very well. People, particularly younger people, particularly the adolescent and the teenagers in the early 20s, where I suppose it's not been present for very long, they actually respond very well and they all come and say, oh, it's significantly better. It's come down by, say, 50%. Even yesterday, I had somebody who's been taking her medicines religiously all through the lockdown. I couldn't see her. And she came back and, there was significant improvement in the acanthosis. So is that been your experience also where?
Yes, yes. Yeah, I'm more user of the alpha lipoic acid for acanthosis, and I really felt that yes, it works well and it's lightened. Along with that, since there is, like I said, hyperkeratosis thickening, and there is also the pigmentation part of it. So I subject them to topical medications like vitamin A, which is removing the excess and shedding and exfoliating the hyperkeratosis. That works. In the second session itself, they feel, yeah, it's looking better. I can feel. So psychologically, as well as we are working towards the pathophysiology of it. Lightening takes time, so we add some lightening agents topically. And there is a treatment called as chemical peels, which go almost to the deep depth of the skin. And peeling helps in, softening the skin, getting the velvety and the reticulate pattern much better. Of course, it's not going to completely go, but they start feeling well about it. And that's what role of the peels and topical agents do have. So lightening is seen even solely if you give creams and chemical peels. Of course, I tell them that we are also looking and we will back you up with the other reasons why you have acanthosis. So I think combinedly it works quite nice. It takes about 3 to 4 months, definitely.
I have a very silly question, Dr. Parul. So this skin lightening creams and all that you're talking about, you advise that they put it even like for people who have it on their knuckles and their elbows and their armpits and every area of their body?
Yes, you get exfoliating creams and you get lightening creams, and you get combinations of those also. So primarily we want exfoliation and we want lightening as well. So you have safer creams of lighter or a lesser concentration, which can safely be used at home by the patients. And when we want a deeper, so that's why these treatments are spaced out every 3 weeks. That's when they come to us. And that's where we do under observation these treatments, which will actually shed off many layers, and it's a visible peeling of skin.
Right.
And by second or third session, you have quite a lot of flattening of these reticulate, velvety. In fact, even the pigmentation lightens to an extent, and they're quite happy about it. It also adds to the compliance, because then they feel, okay, something is working. And that's the opportunity when I take to ask them, are you following the diet which I've told you? Are you exercising? Are you sleeping well? Because I think why they are obese and not because of the unhealthy diet and your sleep habits. So it's also an opportunity for me to counsel them repeatedly. Any objections they have with the medications which the other doctor, endocrine or gynac has started. So, and they also feel good about, okay, now it's getting plain, it's getting better. I can see my normal skin coming up, So I think it hand in hand, it works well.
I think one of the other things that happens is, and I'm sure this happens a lot to you, they come like 3 months before their marriage. And, they say, I need a quick fix, or maybe even 1 month. 3 months is actually good, but, they all come and they say, we need a quick fix because I'm getting married and I need this, fix in a hurry. I'm sure at least with your treatment, you can see an immediate improvement. With the type of things we do, it's going to be really slow. And
yes.
Especially
if they are also going to take OCPs for their marriage, before their marriage, is just going to complicate. Yeah, there are few treatments which are available, which definitely I tell them it's not going to last you too much and not going to give you permanent results. But whatever that 1 month, 2 months, 3 months you have in hand, so we space out few treatments of lightening treatments and try to get them a better texture, try to get the overt pigmentation. So at least we can work on the quality of the skin, little bit on the pigmentation. If they have a lot of roughness, then deep peels will flatten the skin and they are quite okay. I mean, that's what we can do if they come late to us. I mean, can't really do more than that.
One of the things I did want to mention here, just for the benefit of whoever is listening in, last week in the PCOS we had a session, and someone who was doing a study looking at the public perception of PCOS had joined us, and some of the stories she shared about young girls who were so traumatized because of their skin. They are not worried because they're not getting their periods. What they are bothered about is, is like the thinning, but more important, the skin. And I'm sure that, this acanthosis can be also a lot of psychologically a very distressing condition. And I think sometimes, so one of the things we were talking about is people going into depression, because of this, and they withdraw and they don't want to go out. And I've had sometimes mothers tell me that, she doesn't want to go out to functions where they meet relatives because, in our country, what a thing about fair skin is. So, first thing they'll say is, in Tamil, they'll say, that means, how did you become so dark?
Dark,
So
also peer pressure. I mean, this one doesn't do this one doesn't do that, and that poor kid is listening to everybody, and she thinks, what have I done so wrong to get? But actually, it's a sad stage. I mean, the pigmentation sometimes is so overt. You have to take them into confidence that it's okay. Just still we'll work it out for you. And somebody who is actually a different shade 6 months back, and suddenly they have changed into, and especially then the girls take it too much to their heart, and inside there is a lot of battle going on, and the parents are okay, this one doesn't exercise, this one doesn't stop the junk. Too much of, I feel the counseling makes a huge need over here. And we need to handhold them and tell them that don't worry, this is, it's okay if you have it, we'll take you through till the end, how much ever possible.
I remember a young girl. I was just going to say, I remember a young girl who came who was very upset because she couldn't wear her swimming costume, because she had this darkness under her arms.
Yes.
So,
even Bombay, because of the heat, people like to wear sleeveless, and sometimes it looks terrible. And people who have underarm acanthosis, it's, they just stop wearing, it's like a different lifestyle they kind of adapt into, not liking to wear what they want to. So it's quite an, it's just taking up to their minds as well. So I think we need to have good counselors for acanthosis, how we have for psoriasis, how we have for leprosy, how we have for tuberculosis, and all those. I think we need for acanthosis because I think the spectrum is really widening, and we are touching up on, as like you said, a 10-year-old. What do you? I mean, with what heart do you say? Don't eat this, don't eat that, don't eat this. What do you expect them to also follow? So I think we need good counselors. Are there actually available? I mean, are there really counselors who look into professionally counseling for Acanthosis nigricans patients?
I don't know about specifically. Is there anybody like that, Suman? I'm not sure.
We're also not sure, ma'am.
I didn't even know that there were counselors available for like psoriasis and.
Yeah, they are there, ma'am. They are there.
Okay.
There are doctors who do counseling when they are referred for most of the skin conditions, especially when it comes to psoriasis, or if you say a severe acne and there is severe hair loss. There are doctors when they are referred by, even Parul ma'am would be knowing many of them. There are doctors who counsel the patients, ma'am, and they take their course of time along with the medication. This is a part of the treatment, you can say. For this kind of patients, ma'am. But I don't think for
acanthosis, it's not there. Maybe like a support group, abroad I've seen on few, there are support groups. So all people having AN for whatever cause, they come together, they share their experience, and they feel, like-minded people, okay, they're there also. But in my clinic, I mean, whenever I just get up and I think about any patient having that, I just SMS randomly to her, are you exercising today? So that, she knows, okay, doctor is keeping a tab on me. Or sometimes I get one patient who has completed maybe 3 months and got better. I ask her to speak to another patient who's just started the treatment, like an encouragement, like an elder sister talking to a younger one. I tell them, you go chat and just, kind of encourage her to do it, that it is possible in 3-6 months. And I think that close association, they would bond better, rather than a directive coming from me. So that initiative I take in my clinic.
That's wonderful.
Rightly said, ma'am. There is in Instagram, ma'am, if you go and search the hashtag Acanthosis Nigricans, there are communities abroad, not in India. So India, we don't exactly have the medical communities, we don't have. So that is in the nascent stage in India. If you go search that in Instagram, Acanthosis Nigricans, only in hashtag, you'll find lot of people there and they have been sharing their weight loss journey. Because of acanthosis, because of their weight, they had acanthosis, and along with the medication, what they did, how ma'am shared. So they have been sharing their journey. So a lot of patients, they've been exchanging their thoughts